Hello, everyone. Thank you so much for joining us here today. I would love to start by just thanking also the people who couldn't be here but who are watching the recording afterwards. And I'll give a brief introduction to myself as well as to my fertility labs. So today's topic, fertility hormones, is one that is so important and so often overlooked by doctors. And from my own personal experience, it's something that, I wish I had a doctor that actually understood my hormones a lot sooner. But I had to go see many doctors that could help me to balance my thyroid hormones to treat my hypothyroidism. And because of that care, I have my beautiful 1-year-old daughter. And so it's become my mission now to help provide this care to more women. And so with that, I'll tell you about my fertility labs. We provide hormone testing and clinician support to help couples on their fertility journeys. And joining us today, I'm so thrilled to introduce to you Stacey DeMock. She is a functional medicine practitioner, and she helps couples find the root cause of their fertility struggles. And by correcting things like hormonal imbalances and underlying conditions, she can help them achieve pregnancy naturally. So with that, I will pass it over to Stacey DeMock.
Hi, everyone. I'm really excited to be here today to talk to you guys all about hormones. So I'm just going to jump right into things. I'm, again, Stacey Demick. I am a pharmacist, but I got into functional medicine because I was just really seeing a lot of chronic medical conditions, dysfunction, and nobody was ever getting any better. So I really wanted to find out why and discover the root cause. And fertility is something, like Sarah said, that came up for me because I suffer through infertility as well. So I think that's really why a lot of women go into fertility, is because they've kind of navigated the system a little bit themselves and really struggled with it. So I'm really excited to be here with you to kind of talk about hormones, what we can do about hormones, hormone imbalances, and yeah, let's get into it. So basics of hormones. This obviously is going to be just a really general discussion, and I know it's not for clinicians, so we're not going to like deep dive into anything. But when I'm talking about hormones, I really think of almost like a text messaging system within our body. So hormones are basically a message from one area, it goes to another area, and it tells that area what to do. So when we have imbalances in our hormones, I'm thinking about that text messaging system and what is really going wrong with that. So commonly, I think of it as our brain. The pituitary gland in our brain is texting our ovaries, for example, and saying, hey, I need you to stimulate those follicles. And typically our ovaries would receive that text message and say, okay, I need to start developing my follicles. And it will text our uterus to start to develop a lining so that we can get ready for implantation. But often, I don't know if any of you have been in any type of group chats, for example. Hormones are complicated, almost like a group chat where multiple messages are coming in, and it can be really almost disruptive, where you say, oh my gosh, I don't know what message I need to read first or what I need to do first. And that's what I like to think of as hormone imbalance. So then when I'm looking at the menstrual cycle, so women's hormones are very complex, right? With men, it's pretty not, I don't want to say completely straightforward, but with men, it's not as difficult to manage their hormones as it is with women, because we not only have a circadian rhythm that affects what our hormones are doing in a 24-hour cycle, but then we have our lovely menstrual cycle that it really dictates what happens in a kind of 28-day cycle. So I just want to go through basics in terms of our menstrual cycle so that we're all on the same page. So when I talk about the menstrual cycle, there's really 4 phases throughout our menstrual cycle. So we have our menstruation phase. The menstruation phase is when we bleed. So everybody knows what time of month that is. After menstruation, we have a follicular phase. And during that follicular phase, it's exactly what it sounds. It's developing your follicles. And during that phase, our follicles developing, but also our endometrial lining is developing to get ready for that implantation. Then we have the ovulation phase. And Ovulation is when that follicle releases the egg. And when we release that egg travels down, hopefully to get implanted with this, like the egg and sperm together implanted. And during ovulation, we see a lot of changes in our hormones. So the follicle that is remaining will then develop into what we call a corpus luteum, and the corpus luteum then secretes progesterone, and that is when we're basically into our luteal phase. So I just kind of to briefly, so everybody knows what we're doing in all 4 phases. If during that luteal phase there is no implantation, our body then gets ready to shed that lining, and then we re-enter into a menstruation phase. So 4 main hormones that are secreted during the menstrual cycle. So we have FSH, which is follicle stimulating hormone. Again, that is exactly what it sounds like. It is the brain telling the ovary to develop the follicle. We have LH, which is luteinizing hormone. And when we get a LH surge, that is signaling to the ovary and to the follicle to release the egg. And we have estradiol, which most of you will know about as our kind of main female hormone, and progesterone in the luteal phase. So these are our 4 main hormones that we work with for women. For men, a little bit different, right? They still have FSH, they still have LH, but testosterone is their main hormone that is developing the sperm, okay? Other hormones that are commonly not addressed, I guess I should say, during in conventional medicine in relation to reproductive health are things like our thyroid hormone. So we have our thyroid hormone, which is kind of our master metabolism regulator. We have other metabolic hormones like insulin. We have adrenal hormones, which really come into play, especially for women. So things like our cortisol and our DHEA. So these all work basically together, and they work at different phases throughout your cycle. And one can really start to affect the other. So that's where that group text messaging problem comes in, is if you have a lot of imbalanced hormones in a different section of your body, how does that affect your ability to create reproductive hormones? So what we test and when we test, this is really only important for our reproductive hormones. So when I'm talking about like our thyroid hormones, our insulin, our cortisol, DHEA, all of that stuff can be tested at any point in our cycle technically. But with reproductive hormones, it's important to make sure that your physician is testing you at specific times of your cycle. So when I'm talking specific times, I'm meaning on cycle day 3, we always test for FSH, LH, and estradiol. So those 3 are tested at that point in your cycle because that is the time when there's the lowest amount of hormone. After cycle day 3, then you start seeing all these rises. So estradiol rises throughout our follicular phase, and then there's another small rise through the luteal phase. FSH rises in the follicular phase, and then LH always has that peak kind of mid-cycle for, I should say, like a normal cycle. Then we also want to make sure we're testing progesterone. So progesterone is really telling us if we're able to maintain that endometrial lining. And progesterone elevates in the luteal phase. So I know I don't think Christia has a chance to come on to do a live or anything like that, but Christia is our fertility educator, and she really goes into depth on where these hormones are elevating when they're dropping. But during that luteal phase, we need progesterone, and we want to test progesterone 7 days after ovulation. That's really important, not to say cycle day 21, but 7 days after ovulation. And the reason for that is not every woman will ovulate on cycle day 14. That is such a misconception. Women can have a full 28-day cycle, but they still may not be ovulating on day 14. You could be ovulating on cycle day 11. You could be ovulating cycle day 20. And so if we're only testing on day 21, we could be really missing the mark on whether or not you have enough progesterone during that luteal phase to maintain that endometrial lining. So again, as a review, cycle day 3, we're looking FSH, LH, estradiol, and 7 days after ovulation is progesterone. Sometimes I will test estradiol 7 days after ovulation as well if I think a patient may have estrogen dominance, but that is something in itself. So other hormones that, again, we would like to test. So I want to kind of dive a little bit into some of these other hormones and how they affect your reproductive health, because I think that's important for you to be able to advocate for yourself. Thyroid hormones. So thyroid hormones affect our ability to make reproductive hormones. So when we're testing thyroid hormones, what's commonly checked is our TSH. TSH is similar to FSH, but it's a thyroid stimulating hormone. So that's, again, that text message from our brain to tell our thyroid, hey, we need to make thyroid hormone. The thyroid hormone that's mainly produced from our thyroid is T4. So T4 is not actually an active form of thyroid hormone. There is some T3 that is made, which is the active form, but most of it is converted in our body from T4 to T3. I hope I didn't lose anybody yet. So then T3 is our actual active form of thyroid hormone. If that is low, you're actually not able to make as many reproductive hormones. So that is important to test TSH, free T4, free T3, but also testing your thyroid antibodies. So that includes our thyroid peroxidase antibodies, as well as our thyroid globulin antibodies. So sometimes TSH can be completely normal, free T4 is completely normal, but then you might have low T3. Another scenario would be a normal TSH, normal T4, normal T3. And then I've seen patients who've had elevated antibodies, and that affects implantation. So that is why it's very important to make sure you're checking to see if there's any autoimmunity with your thyroid, and to make sure you have enough thyroid hormones in themselves. Other areas that I like to dig into are our metabolic health. So insulin. Insulin's a fun one because it is kind of like the text message scrambler. It is scrambling the signal from your brain to your ovary. Insulin can be a big issue. I'm sure some of you out there have PCOS, have been diagnosed with PCOS, or are thinking you have it but haven't been diagnosed. Insulin resistance has become something that is quite common nowadays. And when we see insulin resistance, what that basically means is that your body has been producing an excess amount of insulin over a period of time. So as we eat food, we convert our carbohydrates. They get broken down into glucose. When our glucose rises in our blood, our pancreas releases insulin to help bring that blood glucose down. So when we do that, and it's a very controlled environment, that happens smoothly. Glucose is up, insulin is up, then glucose comes down, insulin comes down. But over time, as your body has to produce more and more insulin to keep your blood glucose down, eventually some cells will become resistant to insulin. Meaning, if you lived inside a cell and we were in here and we decided to change the locks on the door, that is what's happening with insulin resistance, is that insulin is the key and it cannot unlock those locks. And so that cell itself is now becoming energy deficient. You have lots of fuel outside the door, but it cannot get in. And this causes a lot of downstream problems, including things like fatty liver, but then it starts to affect our ovaries as well. And so when you have insulin resistance, it's basically scrambling that message, and your body ends up producing more androgens, which, if you have too much androgens, it can prevent you from ovulating. So you have more anovulatory cycles. If someone is not ovulating, they are not able to get pregnant that month. Okay. So insulin is a huge hormone that I work a lot with my patients. And I see once we can kind of get their insulin resistance under control, and that's typically through diet and lifestyle, that can help improve the signaling within the ovary. And so that the hormones are actually producing the right hormones for one, and allowing you to ovulate. Next is our adrenal glands. So adrenal glands, this is what I'm thinking about in terms of our fight or flight system, because nobody in this day and age is stressed at all, right? All of us are just going kosher. Everything's been good, which is actually not true at all for women. Okay. So for women, I feel like their adrenal glands are overtaxed, And that's just basically that chronic stress that people are experiencing. I'm seeing a lot of my patients who have a lot of excess cortisol. Maybe they're not producing enough DHEA, which is a type of androgen that comes from our adrenal glands. This whole system is really difficult to kind of turn around in a sense if we are not really focusing on our ability to come into a parasympathetic state. And there can be various reasons for that. I like to describe it as if you are being chased by a bear, what's going to happen? Your cortisol is going to spike, your adrenaline is going to spike. But after that threat is gone, the bear decides to go off and do something else. Those hormones should come down back to normal baseline levels. But because we live in this really, this modern world with a lot of stressors, we're usually overworked, we're usually overtaxed in terms of having to take care of ourselves, take care of our families, do all the things all the time. Women are living in this state of chronic stress, meaning their cortisol, their adrenaline is always elevated. And think about what that does to your body, right? So over time, as your hormones are elevated, your stress hormones are elevated constantly, what is your body going to prioritize? Is it going to prioritize conception or is it going to prioritize survival? And that is what we're really seeing, is that everybody's bodies are prioritizing survival, and you're just doing what you can to get through the day and survive versus optimizing your health. So when I look at these three systems together, I look at our adrenals, I look at our thyroid and our reproductive hormones. If there's any dysfunction within that adrenal system, that has to be addressed as one of the first line options before we start manipulating hormones. Once we get that system under control, typically our thyroid comes back, and typically our reproductive hormones are also coming back to an optimal level. Okay. Moving on. So that was kind of just a broad overview of what hormones that we look at, what we test. Obviously, we want to make sure when we are testing hormones, we're not just testing to test. Like, what are we actually looking for, right? I like to look at optimal ranges versus reference ranges. So, optimal ranges, what does that mean? When I'm looking at a reference range on a lab, the ranges that the lab gives us are based off of our population. So if our population is generally unhealthy, those reference ranges are going to be outside of what is optimal for a patient. It's almost like if I wear a size 7 shoe, a reference range for women would be anywhere between 5 and 9. That's typically what's quoted, right? A women's sock is going to be 5 to 9. But if I wear a 7, if I wear a size 9, is that going to be optimal? Probably not, right? Like the shoe's probably going to be way too big and I'm not going to be able to keep them on my feet. If it's a size 5, they're going to be way too tight and hurt my feet. So what we're really looking for is that optimal range. So somewhere between 6 and 8 is more optimal for me. I probably will be able to fit some shoes that are size 6 and I'll be able to fit some shoes that are size 8, but ideally I'd want to be a 7. Same thing goes with labs. So if we're really looking at that population average, you can see between different labs, they're going to quote different reference ranges. This is the most apparent when we're looking at thyroid hormones. So thyroid hormones, TSH, is optimal between 0.5 to 2. But you can see the reference range on the lab goes all the way up to 4. And typically some labs are going up 5, 9 at the higher end, but that's not going to be optimal. Like, what patient is going to feel good with a TSH over 4? You're not. So that is why I like to really focus in on optimal ranges. And within functional medicine, that is something that we do quite often. And so I would ask, like, are your labs actually ideal? When you are talking to your practitioner and you feel like crap, essentially, like, they're looking and they're saying your labs are just fine. This is where you have to say, like, my labs are not fine. Like, I do not feel good. So there's something else going on. And I want you to help me dig into that. A good practitioner is going to say, yes, like, let's do that. Like, they're not going to leave you hanging and feeling like not well. Okay. So let's talk a little bit about how we make our reproductive hormones. So we have this fun thing called a steroid hormone pathway. All hormones are made in the mitochondria. I don't know if you guys remember what the mitochondria is. It's probably like going back to grade 10, like science biology class, and you're probably having a little PTSD, like thinking about that. But the mitochondria are really that jelly bean shaped structure. And that is where we produce energy in our cells. So mitochondria take our food, our fuel, and they convert it to energy. That's the basic of what they do. However, they also are the location where we make our reproductive hormones. So, to make a reproductive hormone, you need to one, take cholesterol, two, you need to take thyroid T3, so active thyroid hormone. Both of these things come into the cell and they get converted to pregnenolone. So pregnenolone is the start of our steroid hormone pathway. You can go down different pathways. So pregnenolone can make progesterone, it can make cortisol, it can make testosterone, it can make estradiol, and various other hormones. So when that is off, I'm always thinking, what is your cholesterol like? Are you on that fat-free diet? I don't know, that whole age where women were eating everything fat-free, like how is that really affecting their hormones? What is your T3 status? Are you actually making enough T3? What is your mitochondrial function? This is something that is huge and nobody is talking about in conventional medicine. Mitochondrial function is one of the reasons for a lot of issues that people are experiencing, which I will dive into in a bit here. So without those three components, you are not going to be able to make sufficient reproductive hormones, okay? So mitochondrial function. Mitochondrial function, I'm thinking of your ability to make energy. So what kind of conditions am I talking about when I'm thinking somebody has an impairment in their mitochondrial function? Well, infertility is one for sure. But then I'm also thinking, do you have chronic pain? Do you have headaches, migraines? Do you have depression, anxiety, ADHD? All of those things are mitochondrial issues. Okay. So you might sit back and go, whoa, I have like two or three of those things, or maybe you have three or four of those things. Then I would really dig into that mitochondrial function and your ability to make energy. There's a lot of things that impair mitochondrial function. So this can be things from stress, it can be toxins, it can be certain medications, it could be nutrient insufficiencies, which I hope all of you were able to jump onto Priscilla's live last week to listen about nutrition, because it's so very important in fertility. But if you have damaged mitochondria, and this is very important for men's health, especially because they have so much exposure, so many environmental exposures that can affect their mitochondrial function, which in turn affect their sperm health. So this is an area in functional medicine I really dive into. Let's talk about T3 a little bit. T3. So again, I talked a little bit about that conversion of T4 to T3. So that conversion happens in tissues like our kidneys, but also our liver and our gut. How many of you have poor gut health? I'm guessing some of you are going to be raising your hands being like, yes, I don't have good gut health. If you don't have a really good balanced microbiome, you are not converting T4 to T3 efficiently. So gut health is something almost like first line that we treat in functional medicine because it is so important. If you do not feel that you have a good gut, you really need to dive into why don't you have a good gut? What can you do to improve it? How can you improve that microbiome balance? And that will help you convert more T4 to T3. And once you have sufficient T3, then we can look at what are some of the other factors that are affecting your ability to make good hormones. Finally, the liver. The liver is responsible for like 500 different functions in our body. It is our master detox organ. Liver is often overlooked, I find, in conventional medicine because, it takes a lot for our liver enzymes to become elevated. It actually requires like almost like 70% dysfunction before you'll even see a rise in liver function. So everybody's kind of perspective is, yeah, it is our detox organ. It can be, it can take a pretty brutal beating without actually being affected. However, if we want it to function optimally, we need to really take care of it, right? And what do I mean by that? When I look at our liver, we want to make sure, one, we have enough, again, coming back to nutrients, we need enough nutrients for our liver to function properly. We need to make sure our detox pathways are open, and we want to just reduce the amount of toxic exposures we have on our liver. The more we're piling on top of it, I like to refer to as our toxin bucket. The more we're putting into that toxin bucket, you have this little hole, which is called the liver at the bottom. It's helping filter all of it out. But eventually, if you're putting too much in and your liver's not getting enough out, that toxin bucket overflows, and that's where people start to develop symptoms. So really targeting good liver quality, good bile health, that along with gut, as well as your mitochondrial function, is really going to be like the basis of how we restore your general health. So men, again, I was just talking about those environmental triggers for men. They just tend to be in occupations that are higher risk. So that is where I would say, if your husband, if your partner um, is in one of those positions where they're exposed to a lot of environmental toxins, how can we really reduce their overall exposures? And that may be through things that you do at home. So there's lots of stuff that you can do outside of, like, there's tons of stuff we have no control over, right? We have no control over the planes flying overhead, what type of water that we have. Essentially, if you're drinking water, you can choose which type of water you're drinking, right? But we can't control what goes into the water system. You can't control like how many vehicles are running or idling. Like, there's a lot of things that are out of our control. So we try to forget about that stuff and really focus in on what you personally have control over. The more you can control what is available to you, the better your outcomes are in terms of your detoxification capacity and your liver health. So this is somewhere with men. I usually end up doing some type of like detox strategy for them if they're in these like higher risk occupational exposures. That helps to improve their sperm health in terms of their sperm numbers, but also the sperm quality. So when I'm thinking sperm quality, a lot of times when a man gets like their sperm analysis done, the sperm analysis quotes like over 4% normal morphology as being really good. Well, okay, but like optimally, you'd want to have like over 14% and probably closer to 50% to have normal morphology. That is the way, like the shape of the sperm. If the head of the sperm is not shaped properly, the head of the sperm is what houses the DNA. It also is responsible for getting into the egg, right? So penetrating that egg. So if there's any defects in the head of the sperm, we really have to address that because that lowers your chance of creating an embryo. Okay. So that's just kind of like an overall basis, like what hormones we look at. I don't have time to necessarily go into all the different hormones, but that's just generally what I would do with a patient. So I want to move on next to what do we do then? So a lot of this information can be very overwhelming for patients to be like, wow, there's so much stuff that I have to fix. Like, where do I start? And this is an area that I call these like my 5 pillars of health. And it's something I do with every single patient. We review all 5 of these factors and start to talk about what can we start bringing into our lives and removing from our lives. Okay. So the 5 things that I always look at. So we have sleep, we have nutrition, physical activity, stress management, and relationships. So within these 5 pillars, I'm just going to break them down. Let's go through them and we can talk about things that you can do to start improving your overall health. Sleep. So we are not getting enough sleep. Sleep has become something where people are like praised to work more and sleep less. That is not good for our body. Okay. Women actually need more sleep than men. However, in general, I say minimum 7 hours of sleep, but 7 to 9 hours is optimal to be able to get enough deep sleep. That's that restorative sleep, and you're actually clearing out toxins from your body. And then also to get REM sleep, which kind of like helps to all like consolidate our memories. Okay. So we need both types of sleep. And if you're only sleeping 4, 5, even 6 hours a night every night, imagine how much you're not detoxing your body at that point. So I like to use an analogy of like throwing out garbage, essentially. So we're basically creating garbage. So every metabolic process in our body creates some type of waste. We dump that out. At night, the garbage trucks come out and they clear out all that garbage. So imagine if you put garbage out on your street and the garbage men think they have 8 hours to clear all that garbage, and suddenly you only give them 5 hours. What happens to the rest of the garbage? Well, it just stays there, right? It stays there until the next time they come out, and then they're trying to constantly keep up versus being able to like actively remove everything and keep up to like clean out your body. So that's essentially what's happening when you're not sleeping, is that you're building up all of this waste product in your body. So what can we do to improve that? One, keeping the same sleep wake cycle every single day, 7 days a week. I know that sounds like no fun because, for some people it isn't. But if you're keeping the same sleep wake cycle, we're really regulating that circadian rhythm. The circadian rhythm is what dictates when we release our hormones. Okay, so if we're really off balance, so we see a lot of dysfunction in shift workers, especially because they're constantly going from, maybe working nights to working days, and they're off and trying to catch up on sleep. And it's like always that imbalance. There tends to be more metabolic conditions that occur in those patients because their sleep is really dysregulated. So if at all possible, maintaining that same sleep wake cycle. Also avoiding blue light at night. So this is something that has only become a problem recently, even within the time that I've been born, right? We didn't have blue light at night when I went to bed. Like there was no shows on, the TV was off, right? Because there's nothing on TV except that fuzzy screen. So we just went to bed, right? And you can have lights on, you can read, you can, have conversations with your family members, but really when you're staring at your screen late into the night, you're tricking your body into thinking it is still daytime. So you're not producing enough melatonin, and without that melatonin is actually an antioxidant in our body, but it helps to regulate sleep, and it tells us when we produce cortisol in the morning. So a lot of those things become dysfunctional when we're doing the blue light at night. Nutrition, I am not going to dive into nutrition because I hope, again, you went and watched Priscilla's live because she talks all about nutrition. She is our nutrition specialist. And my only plug here is please eat whole foods, okay? So our body needs actual nutrients. It doesn't need fake food, I like to call it. Like it doesn't need pretend food, things that are made to look like food. If you're eating whole foods, that you are going to be like way ahead of everybody else. Okay. So whole foods meaning something that, grew underground, grew on a tree, walked on earth, swam in the water, right? Like things that are like meant for us to eat. The better you can stick to that, and more consistently you can stick to that, I guarantee you your nutrient levels are going to be much better. Physical activity. So note, I did not say exercise here. So physical activity means being active throughout the day. So 1 hour of strenuous exercise is not going to make up for the 8 hours that you sit at your desk all day. And guess what? I'm guilty of this too, right? Because now that I'm sitting consulting with patients, I am technically sitting for the majority of the day. But get up and move your body as often as you can. Even if that means once an hour, you get up and walk around for 2-3 minutes, going up and down stairs, walking a little bit further from your vehicle. Those things all add up and make a huge difference. I find, especially with physical activity and insulin, this is something where you can really reduce your insulin resistance by doing some walking right after you eat. Stress management. I think this one makes people a little bit more stressed in a sense when I talk about this, because they feel like they're already really overwhelmed, and how can they just reduce stress, right? Like having somebody say just calm down, rest, relax, go to a spa, that's not helpful for most people. So in this sense, I'd say work with somebody for your stress management, whether it's a therapist, whether it's your physician, somebody to help you basically help to manage how you can deal with life stressors and what things you can remove. This area is something where I say, okay, if you're that person who is on the news all the time or doom scrolling, those things really affect our HPA axis, which is the hypothalamic pituitary adrenal axis, and that relates back to that cortisol DHEA production. If that system is stressed all the time and now you're always feeding it a lot of negativity, that can throw that whole system off balance and basically keep you stuck in this loop. So if you're going to do one thing at all for your stress management, please stop reading the news every day and please stop doom scrolling at night. That can make a world of difference to surround yourself with more positivity. Relationships. Okay, relationships is something that's almost never discussed with anybody. With relationships, I mostly think of men, to be honest, because in this day and age, men are really isolated, right? Like they tend to maybe have like a couple guys that they hang out with, or maybe they have a bigger group, but nothing is really, I guess, like deeper level conversations, or those relationships are not as present as they used to be. And it's almost like we need to surround ourselves with people, right? Like humans are very social creatures. And some people will say, well, I just like to be by myself. And I'm like, but why? Right? Like, why? Like, what makes you feel that way? And that's usually where we kind of get into deeper things. But if you are not like surrounding yourself with even like one or two other people that you can really rely on, we start to feel that disconnect from the world. And social connection is really what makes us human, right? Yeah, so those are basically the 5 pillars that I like to work on, and something that you can already take away and start managing yourself before you even work with a practitioner. And I guess like with my fertility labs, like I just want to say, like, I just love the concept of my fertility labs because it's all about that restorative reproductive medicine, which is really the basis of functional medicine. Like we want to improve your health, we want to improve your partner's health so that future generations are actually going to be healthier. Yes, there's options to do, IUI, IVF, all of that stuff. Of course, that stuff is like important still. I don't think it's not important for some couples. But if we can really improve your health before you go into those things so that you can allow for healthier generations, like I think that's such a huge thing that isn't discussed very often. And I'm really a huge advocate of it. So I really hope you guys are able to sign up later this fall, early winter. I think it's going to be a great thing. Oh, Sarah, I think you're on mute.
Sorry, I just wanted to say thank you so much, Stacey, for joining us today. It's been so illuminating. And I love the topics that you touched on. I think that your 5 pillars of health is just so wonderful. And relationships isn't one that, I would have even thought of, but I can see how that's so important as well. And you touch on so many important things that I'm sure there's a lot of takeaway for people today. If there's any information for our viewers that you'd like to kind of review later, we will have a recording available for you, because I know that Stacey touched on so many different topics. I do have a question that we actually get asked quite frequently here at my fertility labs. So I thought we'd take the opportunity to ask Stacey since we have her here today. So Stacey, this is probably our number one question that we get asked. So for couples currently undergoing IVF, or they're thinking about IVF, can this type of medicine be used at the same time, or what do you recommend for them?
Absolutely. So again, that came back to that whole restorative reproductive medicine part. Like generational health is so important. So if you are improving your health prior to doing IUI or IVF, your outcomes are going to be better, right? If you go into those procedures with, really dysfunctional mitochondria, or, like abnormal looking sperm, or whatever it is, like your chances are much lower to actually conceive through those methods. So if we can help to improve that before you do that, you're going to be better off, right?
I love that feedback. So thank you so much for sharing. So I do have another question. So this one's related to sperm morphology. So you mentioned kind of the different things that you would look for to see if the sperm is like normal, if there's room for improvement. Are there things that can be done if the sperm isn't like how you want it to look currently?
Yeah, so that all relates back to that mitochondrial health, like your toxin exposures, even nutrients and stuff like that. So that is where I really dive in and work on those pieces. If those are improved, we can really turn over the sperm in 2 to 3 months, which is the life cycle of a sperm.
Oh, that's incredible. And so I have one more question for you.
Mm.
And this is another one that we get asked about mainly from people that, we see interacting at events and stuff. But there's a lot of primarily women that come up to us and they say, I've gone to my doctor. I have all these symptoms and I think I might have this condition, but my doctor tells me that it's part of a normal menstrual cycle. So I don't really know what to do. What would you recommend for those patients?
That's a really tough one, right? Because I think when you go into those appointments, you're kind of at the hands of whoever's treating you. And you don't want to make it feel like you know more than them because obviously they come with, a lot of wealth of information and knowledge. But I also just like, everything changes over time and it takes the medical community about 20 years to catch up on literature, which is a long time, right? So a lot of this new literature that's come out has come out within the last couple of decades. So I would just continue advocating, saying, like, you know what, this is what I found, and I think there's still something else. If you're just not finding that your physician is really going to work with you, then you might want to get a second opinion, right? Or work with somebody who's a little bit more up to date on the current literature that's out there.
I love that feedback. Once again, thank you so much, Stacey, for the talk today. It's been just so wonderful. And I know it's a confusing topic for a lot of people as they're navigating their fertility journeys to just try to identify what's going on. So thank you so much. I would like to say that if you're watching this and maybe Stacey has spoken to you about some symptoms that you're experiencing, and maybe you're thinking, that sounds like there might be something there that I should look into. Or if you suspect you have a condition related to your reproductive health, I encourage you to go to our website at myfertilitylabs.com and to sign up. We're launching this winter, and we would love to help support you on your journey. I'll give a brief explanation as to what's on our platform. So you sign up, you do the patient intake forms, and then you can do your cycle tracking. And then we actually have a team of care providers to support you along your journey. So that includes, of course, our wonderful clinicians like Stacey, who can review your blood work results and look at if there's anything going on with your hormone levels or any conditions that might not be properly addressed. And then we also have nutritionist experts such as Priscilla, as well as fertility practitioners such as Chrissia, who can also support you on your journey. Thank you so much for everyone watching today, and have a wonderful Thanksgiving weekend.